So let's talk about the silent killer. Yes, this condition is called the silent killer because it can kill you without any sign or symptoms. You have no idea that something like that is happening to you. So, and most of the times, if it doesn't kill you, it damages your kidney straight to kidney failure. Yes. If it doesn't damage your kidney, if it doesn't kill you, it doesn't damage your kidney straight to kidney failure, to the stage of chronic kidney failure. It paralyzes you. Yes. Have you heard about stroke? Cerebrovascular accident. Let me just put it in a smaller way. Stroke, the one that you see, either the person has, you've heard it, somebody has a partial stroke or a side stroke. Okay, this is what this condition does to you, and there is no sign. So you have to listen very attentively, and the annoying part of it is that it is preventable. So this is very, very preventable. Okay, that is the annoying part of it. It is preventable. So why would something that is preventable kill you or cause these chronic illnesses for people? What happens is that most people have no idea of this. So it is my life's mission to do these videos to encourage people as small as I can. Right? So listen attentively. This silent killer is called high blood pressure, or high BP, or hypertension, depending on what you know it to be. But most people know this as high BP. The thing there is that if you're an adult, whether a child that is just giving birth to now, a toddler, a child, a baby, an adult, an old man, a girl, a boy, a female, can get affected with this. That is the annoying part of it, and it is preventable. So I'm going to tell you everything you need to know about high blood pressure. Yes, the causes, because most medication causes this high blood pressure for us. The causes of high blood pressure, the prevention of high blood pressure, what is high blood pressure? And when you have high blood pressure, what will you do? Because most people have been diagnosed of high blood pressure, and the problem now is that when they take their drugs. After that drugs finish that they gave them in the hospital, they stop taking it. They feel they are okay. This has landed a lot of people to kidney failure that I'm dialyzing. Most people tell me that, oh no, I didn't even know. I thought after taking this drug, it's finished. I didn't go back. I thought since it has finished, that is the end. No. So this video is loaded. You need to listen. Don't skip, because if you skip, the part you skipped might be the most important part that you're missing. So just take your time. So listen attentively. Everything you need to know about high blood pressure, low blood pressure. I'm going to discuss this on the next video, obviously, because of the video will be too long, right? Okay. So, number one, what is high blood pressure? First of all, what is blood pressure? Blood pressure is a force that the blood exerts on the wall of the artery it contains. Well, you might not really understand it, but most people that are enlightened, trust me, I have a lot of medical personnel watching my video every now and then to vet what I'm saying if I'm giving people wrong information. So this part might not really concern you, but it might concern you one way or the other. Tomorrow you might remember this, and it might help you pass an interview. So remember, blood pressure is the force that the blood exerts on the wall of the arteries, or on the wall of the blood vessels it contains, right? That's blood pressure. While high blood pressure is when the blood pressure becomes so high that is not the optimal level, which is any blood pressure that is above 120/80. Yes. Or any blood pressure that is above 140/90, depending on your age. This is WHO definition, depending on your age, right? But for younger adults, 120, any blood pressure above 120/80 is considered. 139/89 too. Above it can be considered. So now in making diagnosis, before you can't just see probably your blood pressure is 140 or 145/95 and you say you have high blood pressure. For sure, no. For you to be considered that you have high blood pressure, it has been proven on on more than 3 consecutive times, okay, on a different days, okay, that and different machines. So this is your doctor's job. Don't worry about it. Having, when you see any blood pressure above 130, 120, you can talk to your doctor. You come for checkup. They check it on different occasions, then it keeps increasing. That is when you can be diagnosed, okay. However, with some management, it can be settled. Now, having known about what high blood pressure is, let's move on to the causes of high blood pressure. Please don't go anywhere. Listen attentively. So number 1 causes of high blood pressure, I'm going to start with lifestyle, right? Okay, let me go to the things, instead of starting with the things you know, let me start with the things you don't know, so that you will not skip the video. I'm going to tell you the causes of high blood pressure that you don't know. These are the minor causes. However, the ones that you know are the major causes, which will come later after the minor causes that I'm going to mention right now. Okay, so number 1 is when you consume excess salt, whether you like it or not. Consuming excess sodium can increase your blood pressure over a long period of time. Yes. Now, if you're confused on the amount of salt you should take in a day, I've made a video about that, but not with a spoon here, but for reference purpose, it is 135 milligrams. That is a teaspoon. Leveled teaspoon. You can take lower if you wish. There is nothing really is doing for you, because you have other sources you can get your salt from, okay. But if you take this, it is going to affect your blood pressure over a long period of time. Yes, and you wouldn't even know you're taking much, which is why you should stick to a very healthy lifestyle, because eating so many things, highly seasoned things, a lot of highly seasoned things like cheese, noodles, pizza, all of those things that are highly seasoned has a lot of sodium in it, okay. And things that are put to make it palatable to your mouth is there, and these are not really good to your health. So this is why you should eat good, so that when you're consuming sodium, you will know, like if you're cooking your food yourself, you will know the amount of sodium put in it. But when you're eating out, you won't know the kind of sodium that is put in it, okay. That's number 1 cause of sodium. As I'm stating the causes, I'm also going to be mentioning the prevention at once, so that it can go hand in hand and the video will not be too long, right? So that is number 1. Second cause of this condition is there are some contraceptive pills that increases your blood pressure, especially on a if you're in high long of contraceptive pills. So if you want to prevent pregnancy, I suggest you meet your doctor, okay. I also have I've made a video here on natural ways to prevent pregnancy. Natural ways, if you want natural ways, okay. Taking contraceptive pills for a very long period of time can increase your blood pressure. Women do not know this fact, but I'm telling you now, this is why we are here, to help educate you. So don't take contraceptive pills for a very long period of time, except is prescribed by your doctor, which is not more than 3 months, if there are some usually cases for that, okay. So that is it. So how to do this, I've told you how to avoid this. Now, another one that causes high blood pressure is also in the part of some drugs, which are non-steroidal anti-inflammatory drugs. Example, ibuprofen. Yeah, so ibuprofen is an example of non-steroidal anti-inflammatory drugs. Yes, these drugs that help you relieve pain, nasoparin, there's lots of them. You have to really be careful, okay. Apart from causing high blood pressure for you, they can also damage your kidney, okay. Acetaminophen can damage your kidneys. Be careful. So how to avoid this? Do not stop going over the counter. If you've taken drugs for one day, the pain or the symptoms still stays there after 2 days or after a day, just go and meet your doctor. It's better to treat the cause than treating the symptoms, right? So because if you keep taking, it's going to suppress your symptoms down and the cause is still there, and you're now taking excess and your kidney might be damaged. That's for the drugs. Another drugs that causes high blood pressure is cocaine. Yes, there are some drugs, some hard drugs like cocaine can increase your blood pressure. I think that is it for drugs that increases blood pressure. Now let's get to the other things that can increase your blood pressure. Number one, long-term infection. If you have long-term infections, remember when you have an infection, your body system is trying to fight it off. Your body system is not really resting at that point in time. So when you have infection, any type of infection, make sure you get treated. As long as you're having fever, you're having signs of infection, make sure you get treated, because your body is not in the right mood. It is fighting against this. Your blood pressure is going to get high, and a lot of processes will go on, and if this continue, it can also affect your kidneys. That is another cause of high blood pressure. Now another cause of high blood pressure is this kidney diseases. Yes, kidney disease, of course, when your kidney damages, right, the kidney has an ability to manage your blood pressure, okay, so that your blood pressure will be minimal. Okay, there is a hormone that is produced that helps to auto-regulate your blood pressure. So when your kidney damages, these hormones, this process can no longer take place, and you will see somebody's blood pressure 280 over this, 200 and this over. That's my field, so I've seen this kind of blood pressure. So kidney disease can also cause blood pressure. Another one is glomerulonephritis. Yeah, can damage of the tiny filters in the kidney. That is what this glomerulonephritis means. It can also make you have high blood pressure because of the damage. The kidney can no longer really control your blood pressure as it used to. Now, so another thing that can cause high blood pressure for you is a condition called lupus, okay, or lupus, depending on your pronunciation. It's actually rare, very rare, but it's a condition where the body sees this, attacks the organ, the immune system, right? A lot of processes goes on. Let's just not get there, but for knowledge sake, this can happen. Okay, it can increase your blood pressure. People that have these conditions, their blood pressure is always spiking. Now let's get down to the normal causes that that I know that you've been hearing, and I'm going to confirm them if they are true or not. Okay, before then, another one you should be very aware of is taking caffeine. I take caffeine. I like coffee, but you should really be careful on taking caffeinated drinks. Okay, apart from your normal caffeinated coffee, there are some other caffeinated drinks like Coke and some other drinks that you take over the counter. They have caffeine in them. Then when you take your coffee, take other caffeinated drinks, you really should be careful. It increases your blood pressure over a long period of time when taken in excess, because these things accumulate, and sometimes you can feel like your heart is pounding. Okay, so as I'm talking to you, I'm talking to myself because I know I'm guilty of this, but we really need to moderate everything, right? So let's get to the normal causes of high blood pressure that which you should be mindful of. Number one is being overweight or obesity. This can increase your chances of having high blood pressure. Yes, so if you are overweight, please try to work out, try to cut down on your weight. Okay, try to be healthy. Okay, it's better you can be overweight and then you have muscles and you are still looking big. That's better than you're overweight, you're big and it is filled with fat. So try to cut down on your weight. Okay, But again, if you live a sedentary lifestyle, you're always indoors, that's most enjoyment. Eating, watching Netflix, chilling, from here to here. Instead of you to maybe walk or jog, you prefer to take a car. For a 5 minutes walk, you drive. that is not really a good thing. If you're having a sedentary lifestyle, you don't do anything, and all morning you're down, you're in the bed, you're eating, you're relaxing, you're drinking, that's all you do, you are leading yourself to high blood pressure and some chronic illnesses that you're not aware of that will come during your old age. It might not even be up to old age, so just be careful. Right. So another cause of high blood pressure is this: drinking too much alcohol. You've heard that too. I know you've heard that. This is true. Be careful. Okay. So a black African, okay, or the blacks, it's blood pressure, the chances of the risk of getting blood pressure is usually high in black people. And if you don't sleep much, like me, if you don't sleep much, or your sleep is usually disturbed, you just sleep and then somebody wakes you up, you don't sleep, before you know it, it's just in a day you end up getting 5 hours sleep every day. That's not healthy. Okay. That is not healthy at all. So you do not do exercises. I've said it. You don't take you take a lot of salt. I've said it. Okay, now let's get to prevention of high blood pressure. Number one, try to lose weight. I've mentioned it. Try to lose weight. If you're obese, if you're fat, try to get more muscles. Being big is okay, no problem, but at least make sure that you have a lot of more muscles than fat. That is healthy. Okay, limit your alcohol intake. Alcohol doesn't really give anything apart from the ecstasy, so if you can limit it or stop, that's your choice, but I prefer you stop if you can. But if you cannot, just limit it. Get active, right? I've talked about it. Start doing exercise. Even if you're not doing exercise, walk. If you're not working, you're not going to walk. Just like take a walk. Okay, in the morning you just go out, in the evening go out, come back, walk along the street. Okay, until you get a job or something. Cut down on caffeine, coffee and things that has caffeine in them. Stop smoking. I've made mention of this. This will really help you. Now, I forgot to mention the causes of high blood pressure. Yeah. The number one cause is usually genetics, right? Or hereditary. Some people have it in their family, right? Okay, maybe your mom, the risk of high blood pressure, having high blood pressure, if your mom or your parents have had high blood pressure in the past, or your family members have it, so you just need to be careful because you might have it. Okay, so what you need to do is just to constant monitoring yourself and living this lifestyle that I've mentioned. Monitor what you eat and all of those things. It will really go a long way. They might have it and you might not have it. It's not necessary that when your family members has an illness you will have it. With monitoring and prevention, you can avert this, right? Now, remember I've told you in the part of prevention, I've told you that this thing does not have sign. Most of the times it doesn't really show you. Okay, sometimes you might have some few signs, depending. If you're lucky, you might have these signs like headaches at the back, your heart is pounding kind of, or weakness, diaphoresis, like you're sweating kind of. If you are lucky, this might take you to the hospital, but most of the times people don't know, unless they faint. Maybe they fainted and they rushed them to the hospital, and then we'll find out that the person has a blood pressure of 220 something, so this is also part of the prevention. You need to go get checked. Make sure you go get checked, okay? At least 4 times in a year. What is 4 times in a year? It's actually free, okay? Make sure at least every month you check your blood pressure, depending. But if it is normal, it's okay. But just check your blood pressure every month. You can go to a pharmacy. It is free. The ones that will take money from you might be 100 naira, okay? So it is free. Just check your blood pressure. Now, these people that work so hard, the people that are stressed, okay, you need to be checking your blood pressure. I appeal to everyone, please. Let everyone have this high blood pressure monitor. I used to have one, but I gave mine out, right? So I'm trying to get another one. If you have money, have this blood pressure thing. If you have people in your house, people that works for you, your driver, just call them, check their blood pressure. You will be amazed. Most people are carrying the kind of blood pressure they are carrying around, you would not even, you will be amazed. I'm telling you, just check. Let it be like a free will something. It doesn't 1 minute, it doesn't, you can just get 2 cups. If you want the one for the public, you can now be using that one for the public and one for yourself, and you can wash it. The cup, you can wash it. I'll make a video on how to wash it. If you want to wash that thing that they attach here, you can actually wash it. It's not a problem. Okay, so just once in a while, check. There are people that work for you, people around you, maybe your mechanic, you just went to buy something. There's a way you see somebody, well, those instincts you people don't have it, we the medical have it, but just check. Just let me check your blood pressure. You check. I've told you the 120/80 is okay. Anything above 130, 130, 140, 90 is high. Okay, they will now from there take it off. Okay, so that is it about high blood pressure. Now let's talk about the drug part. If you're diagnosed already, so if you have blood pressure already, okay, let me just give you a tips you should take, right? Because there are things you will do that if you do these things, you are going to be taking your drugs, but if you do these things, it will really help you to manage your blood pressure. Okay, it will not always be high like it used to. Stop taking salt, not reducing. Your doctor will tell you, depending on how much your blood pressure is, how up it is. If you can stop taking or reduce salt to the barest minimum, it will be very okay for you. How do you do this? I've made a video on how to reduce salt intake. You can just go watch it so that this video will not be unnecessarily long. Okay, by reading the tablets, when you buy something, you make sure you read them. Fresh food, just watch the video. It really help you. Okay, so people that are also have seen a doctor before and they say take this drug. Now when you finish taking that drug, don't stop. That is where the problem comes. Don't stop. When you stop taking, when the drug has finished, go and meet the doctor again. Ask him, should I continue? What is the doctor will give you a next appointment. Most of the times they forget, I'm sorry to say, but they forget to tell you that, okay, you will come back for so time, okay, and you just get the drugs and go home, and then you stop taking them, or it has finished, you think you're okay. If it's coming back again, it might not really show you signs again. It will just go and, your kidney or your or the brain, right? So that's what you're going to do. When you finish the one, go make sure you're going to see your doctor on a regular basis. There's nothing, you won't pay on a follow-up. You won't just pay. It's just to check you and see how it is being monitored. If he's to give you another drug, he will tell you to buy that drug outside, or he can give it to you, but you'll be monitored. And it is very paramount that you have a blood pressure meter at home. It will really help you, instead of going, if you can't be going, if it's high, sometimes you check. It's not all the time that you will check. When you have a blood pressure of 120, when you have a blood pressure of maybe 180, or less, it's not, you won't take your blood pressure. You have to call your doctor, because that is low, so that it doesn't come down the more. Okay, so if you're now on a maintenance dose, you can be taking, but there is a certain way your blood pressure will be. There's a number it will be. You don't need to take it, like something like 160, 170. You won't take. Of course, it's going to come down further. These are the things you need to discuss with your doctor. Then your diet, you should try to eat vegetables, at least one vegetable in a day. It can be carrots, it can be tomatoes, it can be green beans, it can be ginger, it can be garlic. Okay, this will really help you. Now, if this video has blessed you, make sure you like, because it will encourage me to do more. Share this video and subscribe to my channels, and you can hit on the notification button.